Hi there, my name is Joshua Duyong, and I will be explaining the process of which you perform venipuncture. Venipuncture is the act of using a needle and inserting it into a human body in order to draw a blood sample for basic lab tests. I will be explaining the procedure throughout this video, and I will show you the equipment needed in order to perform this process. Here, I have assembled the materials I need. I have a rubber tourniquet, which is usually latex. If your patient has a latex allergy, you would go with a non-latex tourniquet to prevent a reaction. I have latex gloves. Same thing with the tourniquet. If the patient has a latex allergic reaction, you would use non-latex gloves. I have a sterile syringe still in the packaging. I have sterile gauze, an alcohol prep pad for cleansing. I have an evacuated tube to transfer the blood in after it's in the syringe. And with the request of a patient, I have paper tape to hold down the gauze in case they don't want to hold it. Okay, the first process that I must do, I have to identify my patient. Hi there, miss. My name is Joshua Duyong. I'm going to be your phlebotomist today. May I ask your name?
Susie?
Okay. After I would get her name, I would check the requisition form and her ID bracelet, and I would match them all up to make sure I have the right patient. Next, I will find a suitable vein for the venipuncture process. I will be tying the tourniquet underneath her arm, stretch it out, and tie it tightly around and loop it over and just let it rest underneath. You need to make sure your tourniquet is tight, but not too tight in order to stop circulation, but you'll be able to get blood in. Here, I will use my middle and my pointer finger and try to find a suitable vein. Now right here, I have a nice vein that I'm palpating right now, to which I'll be able to get a nice blood sample, and it's easy to find to prevent a needle stick accident. Okay, I will release my tourniquet and prep my patient. I have an alcohol prep pad here. Now, what I'm going to do, I'm going to use concentric circles. What that means, I start from the center, and I do a spiral outward to prevent infection of the area. I put this aside, and I'm going to retie my tourniquet. Lastly, I'm going to put on my gloves to protect myself from blood-borne pathogens. Okay, now we come to our needle. The way to open the needle is you grab both ends of the tab at the top and you peel it apart and let it fall onto the table so that no human hands have touched it. Next, you break the plunger by pulling it back and pushing it forward a couple of times so that you have no resistance whenever you're taking blood from the patient. Now I will ask my patient, are you having any unusual symptoms right now?
No.
Okay. Next, what I'm going to do, I'm going to uncap the needle. Now after you uncap the needle, there is no recapping. If you would have to recap a needle, you would throw away the syringe and you would get another one. Okay? This, you will feel a slight stick. Are you ready?
Mm-hmm.
Okay? Now, you hold the needle at a 15 to 30 degree angle and you would glidely insert it into the patient. Now you see blood has entered the tube. So that means that you are inserted into a vein, and you could start retracting the plunger and filling the tube with blood. As you can see, this patient has very nice blood, and she's doing a wonderful job. Whenever it's about half full, you untie the tourniquet, and you get your gauze. And before you take out the needle, you just slightly hold the gauze above the injection site and you swiftly pull the needle out. As you can see here, I have a nice tube full of syringe. Ma'am, would you please hold the gauze in place? No. Okay, you see? Example, bending the elbow is a bad idea because what that can do, that can cause the site to rupture, which can cause something called a hematoma. What a hematoma is, it's a collection of blood underneath the skin, and it'll form a small red mound. Think of it like a bruise, except it's like a little mountaintop on your skin, and it's very discernible, and it's not pretty. Now, I'm going to take my syringe and insert my blood into my tube. And as you can see here, blood is flowing freely into the tube. And normally with a tube like this, you would usually invert it 5 to 8 times. But you see, different tubes have different colored tops, which means that sometimes there's different additives in it. This is a red top tube, meaning there's no additives whatsoever in it. This is just a normal tube used for serum testing. And what I'm going to do, I'm going to take off my needle, and I'm going to put the cap back on. This, to prevent a needle stick injury, leave the cap on the table, and just insert the needle slightly into the cap, and then once it's partly in there, you can use it and put the cap back on. And I would dispose of this in a sharps container. Next, ma'am, would you like a piece of tape to hold down your gauze?
Yes, please.
Okay, with the paper tape, you make a tab so that you can remember which side you're going to want to pull the tape from. See, the hair on an arm grows a certain way, and to prevent the hair from pulling, you have to pull it from the inside of the body towards the outside. So I'm going to apply this tape, apply the first end, and I pull pressure, and I'm going to seal off the other end. Next, what I would do with this tube, I need the information of my patient. So I would go get my requisition form. I would write her name, the time, the date of the draw, and I would write the initials of me, which is the phlebotomist that drew it. Next, I would invert it if this was a chemistry top tube or an antiglycotic, and I would invert it 5 to 8 times, and then I would stick it in a container, and I would send it off to a laboratory. After that's all done, I come back to my patient, and I would check her site for bleeding. Now you see, this patient is very good. There is no bleeding. She's a fast healer. So then I would remove the gauze. If the patient would experience any more bleeding, I would ask her to come back to me, and we would assess the problem. Now, thank you, ma'am, for being such a wonderful patient. It's always good to thank your patient because they're very patient with you. I mean, you're doing a process that requires a bit of pain, and you know, in order for their own health, they're being cooperative with you, and they're letting you draw blood from them. So thank you, ma'am, for being such a wonderful patient. Your test results will come from your doctor in about a couple of weeks. You see, normally, the phlebotomist does not discuss test results with a patient. If they were to ever ask about the results, you always direct them towards their doctor. So thank you for watching this video on how to perform venipuncture. I hope you were all successful in your medical career.